Hey guys, Tisha here, and we are back for another Married to Medicine review. This was really more of an information type of situation. So we're just going to be going all over the place. It was a lot of health stuff, some of which I was like, okay, this is good. And then after a while, I was like, okay, y'all, I get it. This is all about health. So we see Toya and Simone meet up for cocktails. They talk about how clean her house is. They talk about how Toya's mom used to have them using bleach and ammonia. She probably wasn't the first person because I do recall doing that myself and choking and having a burning nose and all these other things. So she's not the first person to do that. They talk about Eugene and her need for him to be more romantic. I do see that Toya is a complainer. I do feel like Eugene sometimes does try, and that Toya is a nag. Simone suggests her maybe planning some date nights herself, but Toya says she doesn't really want to do it. Simone lets Toya know that Eugene and Cecil have been talking, and that Eugene basically informed Cecil that one of the reasons why he struggles with planning dates and things for Toya is because she's so critical, and she is. I did not agree with how some of their date went last episode, like how Eugene left Toya's side at one point to go behind the bar, just because it's not something that she really wanted him to do. But Toya was speaking negatively about the date before they completely even walked into the space. She does seem like she wants the moon and the stars, and everything is always in excess. Part of the reason why they've had some of the tax situation and some of the debts that they've had in the past is a lot because of Toya and Eugene's struggle with saying no. So we hear about this birthday trip that Eugene planned, that Toya didn't even like that, even though it was at a place that was on her bucket list. And she said that she didn't like it because Eugene knows that she doesn't like history, even though she wants to be enlightened, that she doesn't like history. And he had the nerve to have her on a horse-drawn carriage, and they talked about history. Simone said, I'm like, are we really sitting here talking about this? Simone says that life is about balance and that she kind of wants Toya to work on that. We then see Heavenly. Heavenly is in her office. She finds out from her assistant that it is a busy day. T.S. Madison is there to get something fixed in her mouth. Heavenly that explains that she originally thought that T.S. Madison had fully transitioned. So she wants to make sure that she is respectful of her and what she desires to be called. T.S. Madison talks about how some of the things that she struggled with and how her main thing as Black people is we have enough struggles. Could you at least respect the fact that she is a woman? That's how she recognizes herself, and that's how she would like to be accepted. Me personally, I don't care what you have going on, what you identify as. You tell me what it is and I'll respect it. I just feel like if you're going to get into a relationship with someone, allow them to know your history in terms of that. That's as far as I go with it. We then have Jackie, who is with a patient, and she talks about how this person is a breast cancer survivor. And as a result, there's certain things that, she's paying attention to. She's noticing that her patient is overweight, has a high cholesterol, and she does not want her to have heart disease or high blood pressure. And I found out that they're also now correlating obesity with certain forms of cancer too. She's gonna give her a drug called semaglutide or something like that. It's basically, I think it's Ozempic, which we keep hearing about. That's gonna suppress her appetite. We find out that some of the negatives of it, that it can cause constipation and blurred vision. Goodness gracious, I can't talk. Constipation and blurred vision. Jackie says that she's the type of person that if the pros outweigh the cons, then she's willing to use it. So for this patient, she's suggesting it because she does qualify, because she's considered to be morbidly obese and because of her testing. We then have Simone, who is also seeing another patient. And this patient has lost 20 pounds from using the semaglutide, the Ozempic. She tells her, Simone does, because they talk about pregnancy and things of that nature, that if she wants to be pregnant, that she's going to have to come off of the Ozempic. And we then are told about how popular this drug is right now, and it still is popular. There are people at my workplace who are using it, some of which needed it and some of which didn't. It worked for some. It did. I don't feel like it worked for others. I'm just saying. And one of those reasons is because one person that I know of in particular, she actually had it for what it's used for, which is her diabetes. And other people were able to get it for other reasons, and they struggle with being able to get a consistent dosage. Part of which, what Simone was talking about, is because there's a shortage. So this was designed for diabetics. And I feel like if it was designed for diabetics, then give it to the people that it was designed for. I just feel like it should not be given to other people. I get that for some people, it's a quick fix. We all have our different struggles. You can look at me and tell I'm definitely not a twig. No offense to people who are smaller, but I wouldn't feel right taking that away from someone who needs it just because I want to lose weight. They talk about pregnancy and the different risks, because at this point, Simone's patient is 44 years old, which then means you can have different chromosomal issues and things of that nature. We then hear about, did I say nature or nature? Nature, if I said the wrong word. We then hear about Georgia having a heartbeat bill, which means that once the baby has a heartbeat, that the pregnancy cannot be terminated. Simone says that this is devastating because if there were to be some type of abnormality or something of that sort, that it's bad enough that they would have to terminate. But now, because of the rules with the heartbeat bill, she wouldn't be able to help out her patient. She would have to send her patient to another state that does allow it. And Simone says that she is pro-choice. And I just feel like it is not my decision what you do to your body. You can agree to disagree. That is fine. But I find it hard to tell someone who was raped, the R word, I was about to say the whole thing, who was R'd or assaulted, or that their child would spend their life as non-responsive or comatose, that they shouldn't be able to decide whether or not they want to continue. Just my thoughts. We then have Eugene and Toya taking the boys to the orthodontist. Ashton lets them know that Eugene was lucky to get Toya because girls don't normally like the nerds. Eugene says that he does kind of agree with what he's saying. And I would say, let me think back. And I don't think I gravitated towards nerds, but I did gravitate towards height. Like, I was always a height person, even though I'm short. I wanted you to be tall. Figure. They talk about their date with kids and how Eugene wants to be taken out too. I've said this in other videos that some aspects of me aren't as traditional, because when it comes to this dating thing, I do feel like it is important for mates to date one another. I don't feel like it should just be on one person in the relationship. What's wrong with taking turns sometimes? We then have Tisha and Dr. G. They head to the doctor's office. She's been down since her diagnosis. She shows what they get from the MRI, and it shows that she has a 5-centimeter fibroid. It is not pressing on the uterus yet. She couldn't tell how much time they would have until that would happen, but she feels like it does need to be removed robotically. Surgery can be a few hours depending on how bad it is. And after surgery, they would like for her to wait 6 months before trying to get pregnant because they really want the scar to heal. Tisha doesn't want to wait 6 months, but girl, when it comes to that, you better listen to exactly what the doctor says, because the last thing you would need for them is to have to perform surgery on you while you're pregnant in that area. We then have Simone and Cecil heading to the boys' condo where they're cooking for them. They bring their mail. Simone brings some gifts for Michael, as well as a black light. And me personally, I don't care what I said, I would never want to shine a black light anywhere in my kid's room or anything like that. I don't want to see it. The thought of it makes me gag. The boys say that it feels weird not living home, but they are happy, and so are the parents. I gotta be honest, this is the most I've seen Cecil smile while in the company of Simone. Maybe they are in a better place. We see Jackie, and she is in a space to do a PSA for maternal mortality in Black women. Heavenly and Simone arrive. Heavenly starts to do her part, and she is struggling because she cannot read the prompter, and she's being too aggressive with her words. Simone says she does have a doctorate. She can read right, but I guess it's way different than her sitting in the closet talking crap about people. I started laughing, but to be honest, I can understand why Heavenly's struggling, because my computer is right here and I struggle reading my own notes. So who am I to talk about Heavenly and her struggles? Sweetie and Toya arrive, and she's about to sit down in the chair, but Simone says, no, I'm next because I got here on time. Toya still sits down in the seat. Simone tells her to get the hell out of the chair. And I was just sitting there like, this is a bit much. The guy that is there to film you all and to make sure everything is being done correctly, he looks uncomfortable. Simone has a tendency sometimes to just go a little bit too far. The ladies are making a lot of noise, and Jackie kind of says, like, y'all, you guys are late. Simone and I are not playing until you see a mother. And she cuts it off, and she says, I need you all to know it's serious, which it was. Simone does her part, nails it. The other ladies are talking in the room about how serious everything is. They then all eventually come back and film their part successfully. I saw the film, and I hope they edited it and it's not what we saw, because they had that light on so bright. There's a major glare going across different parts of the footage. And I'm like, did nobody think to turn down the light? Like, this is too bright. I see why Heavenly was struggling to read the screen with that bright behind light. She was blind. The men meet up at Cigar City Club, and to my surprise, Curtis is there. But I shouldn't be surprised, because he can make the functions when it involves the men. All of the husbands are there, and Dr. G worries if he got the right drink. He wants to make sure that his drink didn't come in a feminine-looking glass. They talk about babies and how cool it would be if they had two, if Dr. G and Sweetie had two, because she's a twin. They then talk about Dr. Alicia, and they find out that her and her doctor husband have been married for 7 years. Let me not call him a doctor husband. He's an oral surgeon. So she's in dentistry, and he's a dental oral surgeon. She was a dentist first, but she kind of stepped back from it for motherhood. Eugene asks, does she love dentistry? Because I used to work with Dr. Damon in the ER. I loved it, and Damon hated it. Now Damon has left, and he is happier. And Curtis says, happiness and fulfillment do have a big part when it comes to your family and your family traditions. He then tells us, Alicia's husband, that he's old school Nigerian, where he's from. The women, if the woman isn't listening to her husband, then it makes her husband look weak. And I was like, okay, be careful with that. I notice how quickly that these men overanalyze things that come out of his mouth, and sometimes they don't ask him to expand upon the things that he says. And just like that, I had to take back my own words, because he says, I love America, but women have been running things for too long, and I refuse to cut off my nutsack. And I said, oh Lord. So Dr. Damon says, that makes it sound like you're saying everybody else here doesn't have nuts. He said, no, that's not what I'm saying. Damon says, I'm of American descent, and I'm of Caribbean descent. And there are generalizations made about American men. And I'm sitting here and I want to know what generalizations that he's heard, because I know what I've heard growing up, and none of what I heard involved that the women were doing too much. What I always heard about American people, and let me say some American people, let me be clear, I was born in the United States of America. My family is not from here. So when I say this, do not kill me in the comment section. But main thing that I was taught was that Americans are lazy. So it was always emphasized not to be lazy, to work hard, to make sure your house looks a certain way, to strive to be better in certain things. Like, those are the types of things that I was taught, but I wasn't taught that the women run over the men or whatever he's saying. Damon says, I'm of both descendants, and there are generalizations made about American men. Eugene brings up how women don't get paid as much. It's still not a lot of equality when it comes to that. They have to work harder, and Eugene is right. He says he feels that men need to be heard, Dr. Alicia's husband. Damon says he respects what he's saying, and he agrees with some of it, but he feels like Damon is going to have his own way of doing things, and that Dr. Alicia's husband will have his own way of doing things. And Heavenly says, if you're the king, you do not need to say that you're the king. Right, Daddy? Right, Daddy? I'm just sitting here listening to all this, and I'm like, please understand that this is going to get back to these women. And best believe it is going to be a thing, because we know that Eugene is beyond the type that will go back and tell his wives. And I'm sure just seeing the reaction in the confessional with the women looking to see if their guys have nuts, and Heavenly letting us know that Damon has big ones, she gonna boost up her man. I don't care what goes on. Heavenly is going ride all the way until the wheels fall off with her man. But that's the end of this. Please like, please comment, please subscribe if you have not done so. And until next time.